over the past 2 weeks, it's becoming clear we are seeing COVID cases rising along with hospitalizations.
And as that happens, there's chaos surrounding the state's COVID-19 orders. So what's being done to fix that? Rod Maloney spent the day working to get answers. And so, Rod, what'd you find out?
Well, Kimberly, what we found out is even though the legislature was not in session today, there was a lot of activity, a flurry of activity, trying to figure out exactly what to do moving forward, knowing the situation we're in. Governor Whitmer's executive orders have given way to the Michigan Department of Health and Human Services clamping down with its own orders by requiring masks still and limiting crowd sizes in bars, restaurants, and other enclosed indoor spaces. Lansing sources tell Local 4 News negotiations are indeed underway between the Senate and the governor's office on more response bills and to reduce the confusion surrounding who should step in and when. One source said the focus is on making the state's overall COVID response similar to the Return to Learn school reopening plan earlier this year, allowing for more local control. One of the things the governor's agreed to do is to start sharing the data with the legislature that she used in her decision-making processes for much of the year. Now, the Mackinac Center for Public Policy brought the lawsuit leading to the Supreme Court's decision earlier this month. Patrick Wright, the lead lawyer, says that he is watching the process very carefully because he is still concerned that the health department may be overstepping its authority with its orders implemented right after the Supreme Court decision.
To the extent that they are seeking unlimited power for an unlimited time, it has echoes of what the Supreme Court said, that the governor couldn't do it. It's very difficult to believe that one of her underlings can do it in her place. So yes, it is of some concern.
Now, they don't have a lawsuit drawn up or anything, but they are clearly taking very careful measure of what it is that Robert Gordon, the MDHHS director, is doing in this. He does have a deadline of October 30th for the current order. It'll get interesting thereafter to see what happens. Back to you.
Yeah, so, Rod, will the governor have the discretion to roll the state back if indeed we do see a second wave of the virus?
Well, it doesn't appear that she has that authority, at least the authority that she was using, but she can work with the legislature. Now, all eyes on Monday morning are going to be in Lansing again because there is a joint committee on COVID response. They're going to be holding a hearing. And no doubt the fact that the cases and hospitalizations are rising will be coming up there.
Yeah, and we will be following it, Rod. We appreciate it.